Olson Huff. Probably many of you know Dr. Huff. He's an husband and a father and one of America's most respected pediatricians. Because of his efforts, North Carolina's children have more access to immunizations and health and dental care than most states in the nation. He's just back from the National Conference of American Academics of American Academy of Pediatrics in Washington, D.C., and he has some latest news from there. He is the chairman of the Committee of Federal Government Affairs. Thank you, Dr. Huff, for being with us.
What a privilege it is to be here this afternoon, and I'm happy to be a volunteer with you in supporting this actual momentous time in the history of our country. You know, we have just moments to make our voice heard, but we have an entire future for the words that we say to have an impact. And so I hope that we will be able to move our country in the direction where we can take our place with the rest of the world and finally provide what our people need, what they want, and what they must have, the basic fundamentals of health care. So I'm pleased to be able to join you in this effort. I do have, I think, a tiny bit of good news in terms of tonight. Conference calls I held yesterday pointed to the fact that we think we have the 60 votes necessary for tonight. Keep your fingers crossed and the pressure on. We can't afford to let down until the final vote is cast. Now consider a couple of things, if you will. My 5-year-old patient, a little girl with asthma, she wakes up in the middle of the night gasping for breath. Her mother, who is a single parent, works 2 jobs, and it takes her just a tiny bit above the cutoff for Medicaid or for the CHIP program. She has no insurance coverage. She must go to the emergency room. She has no preventive care that would keep that child out of the emergency room, and therefore she will need to go back again the next episode of severe asthma. She will lose a night's sleep, go to work tired next morning, and will be at least $1,000 deeper into debt from which she may never recover. She will lose much of the productive future that would allow for better tax production for her and for better work production for her and her community simply because she has no fundamental access to that health care. You have heard many times during this debate that has gone on this last year that this is an economic issue, that unless if we have the kind of reform that we're talking about, the country will go bankrupt. You have heard over and over again the fact that we will go into economic despair. My friends, let me tell you something that is very fundamental to the discussion we are about here today. This is not an issue of money. This is an issue of justice. And we absolutely must make those that we have hired to represent us in Congress hear that message. Justice, not economics, should guide the determination and the opportunity and the future of every child, man, woman in this country. Justice now, health care now. We can't wait any longer.
Now you may have seen me use